Hello. I thought I'd talk a little bit today about what I have in my RACP clinical briefcase. These are the tools that I had in the briefcase for the RACP long case when I sat it, as well as the short case, of course, the clinical exams. So I'll go through each item one by one. First of all, of course, got a stethoscope. I have a Littman cardiology 4. This is just a cardiology, a Littman Classic 3. I think it's quite nice to have both a sort of diaphragm and a bell, just for showing the examiners when you'd use either of them. So of course, stethoscope, very necessary. Next, for your neurology short case, we've got a Queen's Square tendon hammer, of course the flexible type. These probably are the best ones to elicit reflexes. I find them much easier than say a Taylor hammer. And of course you've got sort of a blunt end here for scratching the lateral aspect of the plantar aspect of the foot for Babinski sign. You also do need a bunch of stopwatches, and how do I get into, I'm not sure how we get into that setting. Is it this one? Nope. This one? Anyway, this one's probably easier to sort of see. It's just really a cheap digital watch. We're not allowed to bring smartwatches into the exam, but having at least two of these means you've got one you can use to sort of say time a few things, check the pulse, measure for 15 seconds using this, multiply by 4, and respiratory rate in a similar way. And then you have a separate stopwatch to keep track of your time, say during a short case or during your long case, to make sure you're keeping track of things. Next, I have one of these sort of retractable measuring tapes. These become very useful for numerous reasons, because you will often need to measure things. I guess a good example would be, say, if you were doing the Schober's test, I think, for ankylosing spondylitis, one where you sort of setting 2 points, 2 markers, and then getting them to flex forward, and then seeing how much the spine can elongate. So these are quite helpful for that. But you can also have, I think I've got a few of these, reusable, not reusable, disposable paper tape measures as well. So I've got a few of these here. The thing that dropped was actually one of these. If you're just wanting to test one eye, or I guess both eyes, then you wouldn't use this, but you could cover one eye this way and then just test visual acuity, for example. Now this also has a pinhole set up here, so if you wanted to test, say, a patient's in front of you, left eye here, and then if you wanted to test the right eye, then you cover it this way. You've also got a ruler here to measure, I guess you can use that to measure the pupil. So it's really quite a nice sort of device to have, and the patient can hold it themselves with the handle here. You just need to tell them where to and how to cover. So this is really quite a good tool to have. Also just have a bunch of wooden spatulae. we would use these typically, I mean, I wouldn't typically use these to test gag reflex. We have we use something else for that, but the spatula, of course, to depress the tongue and to be able to examine the posterior oropharynx. Next, I have the things that were making that noise earlier. We've got two tuning forks. This one, they're both in C, so 128. So this one is for vibration testing. So I don't know if this, you can even hear, it's very, very deep sort of C, a low C. But everyone has vibration sense. You'll be able to feel that and sort of feel that, and then say, well, when do you feel the vibration stop? Then you have, well, you don't really use this that often, so it's a high C, 512 Hertz. And you can use this for, say, the Rinne and Weber test, but we don't often test that. A couple more things. These are, I think these are hat pins. Got a white hat pin and a red hat pin. I don't really use this, but the red hat pin is quite useful for visual field testing. You bring it in from the perimeter and then doing confrontation testing using this. Whereas, say, on the ward, if you're doing a more crude way, you might do the wiggling fingers from the peripheries. But this is a better way of testing. You can also test for smaller deficits because it really just provides a discrete sort of target, and so when it disappears you can even measure the blind spot. So this is really quite a useful tool to have. Next I have this little setup here, so a sort of heavy padlock and a little small jar. It's almost like a urine specimen jar with some keys. So these are for functional testing, and it kind of, you can test two things here. With this jar, if I ask the patient to unscrew the jar, that's already one particular functional task in it. For example, if you're at home, you're opening a jar of jam or something. And we've got the keys here, and then we'd ask them to try and open I think it goes this way, open the lock for me. So another functional task, like opening, if you've got keys to your house, for example, you don't have to have this. You could ask them just to hold the keys here, and you hold here, and ask them to try and turn the key and see how well they do. But these two kind of serve that purpose. I think I also have another little thing, if it's still here. Oh yes, I do. So we've got a cut sleeve from an old shirt, and we ask the patients to button and unbutton the sleeve, because that's another sort of fine motor task that matches day-to-day function. You need to be able to dress yourself, and for some people, if they struggle with this, perhaps because of small joint disease in their hands, that may have a certain impact on their day-to-day life. I'm going to pop these to the side. In terms of sensory testing, we kind of keep cotton wool here, and these are just tiny sort of cotton, not really swabs, but you can grab a wisp of that and then sort of twiddle around with it till it goes like this, and then use that for light touch. I think that's dorsal column testing. And then we've got Neurotips, and if I'm right, this one somehow got broken. But Neurotips are quite handy things, because they're a red target as well. They come in red and white, but you could almost use this like a red hat pin, although really what we use them for is for sharp and dull testing. You take away that little red bit here, and then that opens up a sort of sharp here, and you can do sharp and dull testing, always being careful not to pierce the patient's skin, of course. I need to bin this one. I generally keep Bulldog clips, very small ones. And the reason why is when I did my long cases, instead of using Manila folders, I really liked system cards. And you know, I basically have about 12 or so system cards, and we'd be able to just hold them in a little clip like this. And each little card would have a special thing on it. Maybe it's one problem like atrial fibrillation, and you'd have all your bits and pieces written down in the front, and then your management and investigations that you might do, your ideas written on the back. And after you've sort of done your history and examination, you've got that 10-12 minute gap between seeing the patient and then presenting to your examiners. You could just shuffle these cards around and get them in the order that you need them in, and then just present them in a systematic and logical way. So Bulldog clips were helpful for organising these system cards. I know this is actually an A3 piece of paper, but really a sheet of A4 paper is quite handy. What I use this for, there's two kinds of uses for it. One is sort of for fine tremor testing. If someone had their hand placed here, they've got a bit of a fine tremor like this, you place it on here, then it really sort of demonstrates that fine tremor. So that's quite a useful thing just from a piece of paper. And then I think you can also do Fromont's test. If I remember, it is, I can't really do it, it's an awkward angle, but sort of pulling each other, we're testing each other's strength. I have a bunch of these, but it turns out that we're no longer allowed to bring these in. So Ishihara plates, Kermit the Frog Ishihara plate, we hardly ever use these anyway, so not that helpful. The Boston cookie jar for sort of aphasia testing, and then a sort of diagram of various objects for naming, so testing for anomia, and then various an instruction, so reading instruction and then performing it, as well as I guess 3 quotes or phrases for patients to repeat. So it's sort of a test of reading, and I guess also a test of for dysarthria, speech slurring. Very standard, a Snellen chart. These ones are quite nice. I think this one's whole chart 6 feet from eyes, about 2 meters, and then we can get a rough approximation of their visual acuity. If you're going to do testing for gag reflex, and it's not that common that we do, we've been told to use essentially these long cotton swabs, and basically it's not pleasant for the patient and it's not pleasant for the examiner either, so we don't often do that test. This is quite a fancy one, and this really is probably an optional extra. So this is a 10-gram monofilament. You can sort of see the nylon filament here, And these are used, diabetic monofilaments for testing sensation for diabetic foot. There's a usual pattern, I think it's a T pattern of spots on the foot that you check. And basically, when that filament buckles, you know you are delivering 10 grams of force. So it's actually quite well built. I like this. The standard tool of the trade is a pen torch, an LED pen torch in this case. It also doubles up as a stylus and ballpoint pen, but having a pen torch is very helpful, of course. An extra light source in when you're testing for directing consensual responses, swinging flashlight test, etc. A ballpoint pen. Now I like fountain pens, and I did use fountain pens for my long case, but ballpoint pens won't spill and they won't leak into your briefcase. So if you're trying to be I guess safe, these are probably a safer bet. I also have just a bunch of it's like post-it notes, but almost sticky labels, and I actually use these for the Schober's test. So the one where it's sort of testing for how much the lumbar spine is able to widen. You'll have two of these sort of stuck here, and I think it's 10 centimeters apart, so you measure it with that. Where is it? There you go. So you measure this 10 centimeters, which is about here, and then get them to bend forward, and then if it was normal, it should be more than 5 centimeters, I think, of widening. Anyway, so that's helpful. And I think that's everything in my clinical briefcase box. Some people also brought along their own ophthalmoscopes or fundoscopes, but I didn't feel it was going to be necessary because we were told that if fundoscopy was required, we'd have one in the clinic room, and that did turn out to be the case. That was quite alright. So those are all the tools I have in my clinical briefcase. I hope that was interesting or helpful.